I heard about Drexel's case from Dr. Arauz. Drexel came with a history of pain and a bump in his leg, and he had been seen previously, and there was a suspicion that he had a lesion in there, so I was consulted. Once we had the confirmation of the diagnosis, we evaluated his case. First, we did several studies to see if the tumor was confined to his leg or if it had spread to other parts. And once we knew that it was confined to his leg, we decided to start chemotherapy, which is to give him medications to kill all the, or at least most of the tumor cells. This is usually followed by surgery in which what's left of the tumor is removed, and then more chemotherapy to kill any cells that may be left after surgery. Centro Médico Paitilla has the facilities to administer chemotherapy, to do the surgeries that are necessary, as well as the pathology services that are very important for patients with cancer.
His case is a very challenging case because usually in the past this type of cancers require an amputation. The patient without any doubt would have an amputation of his leg, and then his future would be use a prosthetic device if that was available, or just use crutches and walk with one foot and two crutches. So in this case we had the opportunity to do a limb salvage procedure to keep his leg, which is excellent because it's much more different for Drexel to have his own leg than not having it. So all his goals, all his future is completely different if he has his leg or he hasn't. So he had a tumor that was about 15 centimeters big. It was a big mass. And that would spread if we don't remove it and if he doesn't get the chemotherapy he needed. So from the surgical point of view, what we did was that we opened the whole of his knee from the front, and we came down to about half his leg, opened everything, then we slowly started to go behind the tumor, because as you would consider, the tumor has a lot of arteries, has a lot of veins, has a lot of nerves, and we need to remove all these without damaging them, because if we damage them while we are doing the surgery, which I told him that sometimes the nerve is in the tumor and has to go, and that's something that we might lose some function in order to preserve his leg.
Well, we have a very good unit here for the Centro Médico Paitilla. It's a comprehensive oncological center where we have all the specialty. In this case, we have Dr. Arauz sending the patient to Dr. Boyd. Then he did the diagnosis, and then he talked with Dr. Saldaña, who did the surgery. And we also have the facilities for good pathologists and also for the chemotherapy.
In my capacity as medical director, my dealings with Drexel have been astonishing. When I first met him, I was amazed that a 17-year-old could be so aware of his medical condition, medical terminology, and his future needs for his medical care.
Well, as I say, I didn't know what to expect, but when I do land in Panama, I was very impressed of the island, and I know there's something good here for us. The way they go about doing their thing, I know that they know what they are doing. And I was happy that I come to Panama to get the treatment that Drexel had needed. And I was very impressed. So there I do my counseling with him at home and let him know, in spite of what your tumor may be, there is a God that you can trust. The doctor only could do that much and do what they can and use their wisdom and understanding in that area. But there is a God you have to believe.
Okay, here I'm at the Paitilla Medical Center, and this is the oncology. This is the outpatient department, and this is where I get my medical treatment. As you can see, it's very comfortable and inviting. As I wanted to do aeronautical engineering and to be a pilot. That's what I really wanted to do. And in order to do that, you have to be very determined because there are lots of pilots out there. So you're in a very competitive field and they only pick the best of the best. So you have to have this self-will, determination to get through to your dreams.
Drexel would not be here today to tell a story if it wasn't for the determination and the resources of the government of Anguilla, the Minister of Health, the Permanent Secretary of Health, Social Services, and the staff at the hospital that saw to it that Drexel has been referred for treatment abroad by International-Triage network in Panama. On behalf of the network and on behalf of all the doctors, the staff, the social workers, and all the people who did good and right by Drexel, I urge you, join Drexel's fight. Make his dream come true. Help any which way you can. Drexel needs you.